Bore da I chi gyd. Diolch yn fawr, Anton. Thank you very much, Anton, for that welcome. As Anton says, it's been many, many years that we've worked together, but only the last 3 months in my role as the Postgraduate Dean within Health Education and Improvement Wales. And it's a great honour and privilege to be in that role, but I have to say it comes with a little bit of a weight of responsibility. And, I was asking myself why that was, because having been involved in this area, there were no real surprises in terms of what that role involved. But I trained in medical school in Cardiff a long time ago now, and all my postgraduate training was also in Wales. And that was despite coming under a lot of pressure from bosses at various times that I needed to go elsewhere to enhance my career. But I managed to dip in and out of experiences elsewhere, but my motivation and my passion really was to serve within Wales. And that hasn't changed. And I think that sort of weight of responsibility I feel with this role really comes from the desire and passion to address some of the areas which Chris has outlined very well and which I wholeheartedly support in how we have to change how we deliver and support healthcare for the population of Wales. And when I talk about Wales, I do mean every corner of Wales. I do not forget about the north and the west of Wales, especially as someone who hails from the north. Now, obviously, this, I will run through a little bit about Health and Education Improvement Wales and the context that we're in and some of the priorities today. But I was delighted that the theme that Anton outlined for this conference was working together. Because really, unless we get that collective working together and collaboration, then we really don't have much hope. I have my own ideas about where we go, but that's a very small number compared to the collective number of ideas that are out there. And really what we want to do is harness those for the benefit of everyone. Knowing that if we can improve the lives of trainees and trainers in Wales, then that does translate to improved outcomes for patients. So, Health Education and Improvement Wales. It was our first birthday yesterday. So it's a relatively recent organisation, and I suspect that most of you in here now are familiar with what it is. We're sort of getting out of the habit of referring to the Wales Deanery, but the Wales Deanery exists, or the functions of the Deanery exist within Health Education and Improvement Wales. But what the organisation has done is bring together 3 organisations that will be familiar to most of you. So, Wales Deanery, the Wales Centre for Professional Pharmacy Education, and the NHS Workforce Education Development Services. So, effectively bringing the medical and the non-medical aspects of the healthcare workforce into one organisation. We know that this working together across all the professions is going to be key if we're going to address some of the issues that we currently face. So, the context. Where we are. Well, there's a little map of Wales right in the middle, our small little country with just over 3 million people. However, that in itself brings us challenges. Most of the urban areas are in the southeast, and about 80% of our landmass is classified as rural by all those definitions, which brings its own challenges in terms of healthcare delivery. In these various boxes, I've sort of illustrated some of the contexts that we currently find ourselves in terms of postgraduate medical training. My responsibility as the Dean primarily is around the medical training, postgraduate medical training, but clearly that is a wider remit now in terms of how we align that, both in terms of how we train, but also how we make sure it's effective in the multi-professional context. So, policy I've put there, Chris has referred to some of these sort of areas. Of course, we're all familiar with many of the policy documents, Healthier Wales, the legislation, the Future Generations Act, the Language Act. All of these things are important in setting out some of the challenges that we need to embrace. We're familiar with the fact that too much of care is provided in hospitals. We need to move it out into the community. We need to change our approach to the consultation, managing patients, about sending patients into hospitals, as Chris has alluded. But it's challenging. It does require a whole change of how we think and do things together. At that same time, we have policies that come from the training environments, the colleges. You'll all be aware of shape of training, again, recognizing the need for a change in how the profession delivers its training, with more of a focus on training around generalism rather than specialty. Not to belittle the importance and the impact of specialty, but recognizing the whole of people and the fact that we need to consider individuals as whole. So these bring logistical challenges, and as you'll be aware, the new internal medicine curriculum started this year, which changes our 2-year core medicine program into a 3-year internal medicine curriculum. Again, shifting that focus to prolonging the exposure to the general side of medical care. Digital is up there. Many of you will have read the picture on the bottom left, the Topol review, which outlines the challenges that we are facing in this digital era, and the need for us to embrace technology, but importantly use technology to give us the gift of time in terms of what we do. The challenge that we currently have is finding time to think and do things differently. I've put up the environment there. My experience through training in Wales, I had a fantastic time, but there were some environments that I worked in which were less supportive than others. And of course, that is always thus. It's influenced by both the culture of an organization, the people that are within it, and how we all work together. And one of the biggest challenges to all of us out there to work to a team is really to ensure that training environment is what we would all consider positive, supportive, and the sort of environment that attracts people in and makes them want to stay and work for the benefit of the Welsh population. I think environment in the broader sense, we hear about it on the television in relation to plastic and everything else. That's equally important for us to consider. Just this morning we were discussing with colleagues in the foyer there about trainees from North Wales who are expected to drive down to South Wales for an ARCP and perhaps have a 5-minute conversation because everything's going well, and they get back in their cars and head back up to North Wales. Well, that is not acceptable for the individual or for the environment or anything. So we have to start thinking better about how we manage the whole of the system. Wales is not alone. The problems Chris mentioned, the global context that we were in and the challenges that we're facing with health delivery, urban versus rural, healthcare workforce, recruitment challenges. These are global issues. They're not just ones that we face, the UK and much, much wider. We do rely heavily in this country from our medical workforce from overseas recruitment. And particularly in Wales. Interestingly, this year in the United Kingdom was the first year where more than 50% of the doctors who registered to practice with the GMC in the United Kingdom were overseas graduates. Part of that is driven by the fact that the visa cap, which limited accessibility, was lifted a couple of years ago. And we may see a difference again because as of next week, the announcement is that medicine in all the specialties, the generalists, medicine, surgery, whatever specialty you're in, will now be on the shortage occupation list, which effectively removes the resident market labor test requirements and makes the workforce much more accessible to overseas doctors. Also changes our whole approach to recruitment. So we should recognize that we are very dependent on overseas colleagues. We should also recognize that it's much more of a step for some of those colleagues to enter the NHS and to come to countries like Wales or anywhere else in the United Kingdom. And we must recognize the support and encouragement that's needed. It's fantastic that we have such a diverse healthcare workforce, but we also need to make sure that we support and recognize individual needs. Predictions for the workforce. World Health Organization says by 2030, a conservative estimate, in the current ways we deliver healthcare, there'll be a 20% shortfall in the numbers of healthcare work professionals. In other words, as Chris was saying, if you carry on doing what we do now, we're not going to succeed. There does need to be a change. There's a 20% gap there that really needs to be filled by doing things differently, working differently, and considering what we actually need to do that's of value to our population. And we need to embed all these principles into our training. So how does this translate in terms of our workforce, our recruitment? What are our priorities over the forthcoming couple of years? Well, we continue to, core business carries on, and there's a huge amount of bureaucracy, and we have to sort of fulfill all those requirements, and it takes a lot of time. But we must not lose sight of the things that do need to change. And I've already had lots of information coming in from trainees, trainers, about the things that really affect them and matter to them. And often these are big, big challenges to change. They're really whole system changes, and therefore often get sort of sidelines because of the challenge that's involved in making those changes. In terms of the trainee experience, we need to look at increasing our retention. One of the issues that keeps coming up is the bureaucracy of changing and re-engaging with employers and all the paperwork that's involved with that every time you rotate between health boards. And some of our specialties rotate very frequently. So this is a real challenge and frustration and unnecessary bureaucracy for our trainees. So one of our priorities is scoping out single employer models that already exist for general practice, how we may well be able to implement that for the 2,500 secondary care trainees that are in our system that are not part of a single employer model. We hope to have completed that options appraisal within the next month or two, and then we'll be liaising with Chris and colleagues in government to work out how we can implement something to deliver the chosen option. We know that the cost of training has risen astronomically, particularly in certain specialties, surgical specialties. The cost burden on individual trainees to fund the requirements of their curriculum is increasing all the time. We are currently in the process of looking at how we use study leave. The current system is not really fit for purpose in the current model of how study leave is required by trainees. And we're looking at the options as how we could use that money more effectively to meet those needs and more flexibly. It's about the flexibility within the system to maximize the opportunities and to relieve that individual financial burden. Trainees are coming out of university with very significant debt as it is, and that continues to mount for a considerable time. I've put North Wales, but North Wales is a specific, a specific challenge in terms of our rotations. We have issues in terms of how we manage West Wales. This is really about more rural areas, the additional challenges faced by recruitment, and the fact that our current system makes the experience that individuals in those areas in training makes it slightly less good from many aspects than colleagues in the tight southeast because of the access to where many of the opportunities are. So we're in close conversations with North Wales colleagues about what can be delivered, and we are liaising with colleagues in the northwest of England because many of our programs require access to the training opportunities there in order to meet curriculum requirements. We have to be more flexible in terms of accessing opportunities. Simulation is part of our strategy. We all talk about it, but we don't have clear methods of ensuring consistent approaches to delivering this, and that is also a priority. There is clear evidence that repeated practice and considering those human factor skills, in particular around team working and the multi-professional team, these are crucial to improving the consistency of performance in the workplace. I've mentioned curriculum implementation, I've mentioned workforce. We're already starting with the challenges of how we look at the workforce challenges. We've talked about community care in the community, closer to home, avoiding hospital. This is a big shift which has been talked about for a long time. We know we need more GPs. This year, we've seen our recruitment in collaboration with Welsh Government. We've increased the number of places for GP training, and we've seen that hit an all-time high in terms of new numbers starting in general practice this year. Round 2, as it's called, is currently in progress, but we're anticipating between 170 to 180 people starting in GP training this year, which is about 50 more than last year. Equally, Wales is leading the way. You'll be aware that GP training is a 3-year program, which traditionally is 18 months in secondary care and 18 months in general practice. We're moving to a model in several areas of Wales where that will be 2 years in general practice and 1 year in the secondary care sector. That is the feedback that's come from trainees in terms of what meets their needs. We think it also meets the service needs, and it's compliant with the Medical Act. The important thing is, before those of you who are in secondary care start panicking about the move and the shift out, because we're aligning this with the increase in numbers, we've been able to model this without having a detrimental effect in the short term on secondary care teams. Foundation. On that previous slide, you may have wondered what these strange figures were at the bottom right. Well, effectively, they were a quick summary of where we're at the moment. So 415 are the numbers coming out of our 2 medical schools next year. 339 is the number of foundation posts. And then at the next level above that sort of old-fashioned SHO tier into the sort of specialty areas, we're looking at 450 to 500 posts in Wales. So we have a slightly strangely aligned workforce plan in terms of numbers. Now, I know the workforce is mobile, it changes, it's not just about being self-sufficient, which we can't be, but I think there is scope for us to be much more aligned in terms of how we match both our med school recruitment, our retention, and particularly our foundation posts. Our foundation posts, we feel need to increase. With all these changes we were hearing about with shortage occupation lists, we feel there's capacity to increase. And we're currently scoping out the options to increase the numbers of foundation posts in Wales. And to align those very much more, not with the traditional ways we've had foundation posts, but looking at the needs of what our population need in relation to community provision. So I am not standing here to tell you that the single lead employer model will be in place next year or we will have more foundation posts. What I am telling you is the areas we need to start to influence and work with together and understand where we're going. So I think I have a great support team in HEIW. We clearly do have a vision in terms of some of the things that need to be done. But to deliver that, we need to work collectively with all of you. So I think just to finish, I'm going back to the theme of this conference, which is working together. I will ask you for your support, and you will, I promise, have mine. Not that I necessarily can promise to deliver everything we all want as individuals, but I think we collectively need to agree on our priorities. Diolch yn fawr iawn I chi gyd. Mwynhewch gweddill y cynhadledd. That is, thank you very much to all of you and enjoy the rest of this excellent looking conference that Anton and the team have arranged. Thank you very much.